Hello, everybody. We are back live from Sontara Studio at Belmont University. I'm Abby Lemon-Stevens, and I'm joined with Chase Spurlock. We're joined by Paul Benton and Sophie Green from ABHI, the Association of British HealthTech Industries. They're going to tell us a little bit about their Tennessee delegation and what's next.
Thanks for having us.
Thanks for being with us. Okay, so just to kick us off, you guys are visiting Nashville. What have you leaned into most? And is there anything that we've got you hooked on?
All of the above. It's got to be. I have to admit, I am a bit of a fan of your hot chicken, but that's it. There's a big debate over whether it's Prince's or whether it's Hattie B's.
Yeah, what's your take?
I'm British, so heritage is really important and history is important. So I had to start with the original, which I believe is Prince's, right? Exactly, yeah. But no, we're hooked on Nashville. It's a fabulous place. It's great to be back.
Incredible. Sophie?
We're going to try Hattie B's on Saturday so we can weigh up both. So we'll decide then which one's best. But yeah, no, it's a great place. The culture is amazing. The people are super lovely as well. So I think I'm hooked on that initially.
I love it. So good.
Paul, can you talk a little bit about the history of coming to Nashville? What do you see in Nashville, and what do you see as the opportunity for the future between forging this connection between the two communities?
Yeah, I think, it was a good 10 years ago that was my first visit to Nashville. And I think for me, the strength of the health economy and that kind of community here was a real sort of standout moment when my first visit. We were talking a little bit earlier on about the fact that in the UK, when you talk about coming to the US and bringing health technology solutions and health to this side of the Atlantic, there's a sort of gravitation quite often to the coast. And actually, there's an incredible healthcare story here and an incredible scale to your health economy, which is less known about. And I think the thing that really stood out to me when I first came over here was just the sheer impact of the providers and the academic institutions that were here really stood out. And I think there's an exceptional opportunity to join up the assets that we have in the United Kingdom with the different institutions and organizations that you have here. Because fundamentally, we're all trying to solve the same healthcare challenges. It doesn't matter whether you're here in Nashville or whether you're in Newcastle in the UK. We're coming at those challenges and those problems in health from slightly different perspectives, different health systems, but an awful lot that we can learn from one another by bringing those communities together.
And when people ask me, what do I see as the opportunity for two-way collaboration? It's to avoid having to reinvent the wheel. And there are amazing solutions that exist all throughout the world, not only in the UK, but even thinking about Africa. Some of the very cost-effective solutions that they're bringing forward that can also benefit us here in the United States to propel rural health transformation, which is a big theme in the US right now.
Yeah, and there's a whole piece, I think, around frugal technology and different parts of the world that we can learn from. Innovation isn't just about the newest, shiniest thing. Sometimes that innovation is really simple in its form and can be born anywhere around the world. And I think that's what's great about having these communities that are able to connect, is that it gives us an opportunity to be able to share those ideas and some of the approaches to those challenges.
One of the things that I love and have started witnessing is just this very friendly relationship that ABHI in Nashville has developed, right? So tell us a little bit more about that. You've articulated some of the necessities and collaboration, but tell us a little bit more about Nashville specific and why us.
I think arguably it's probably one of the most important part of it. I think that the sort of friendly nature of this, it all starts in a genesis of trust and so on. I think that's a theme that, as we were talking earlier today, it came out in a number of the panels that we're running. And I think a lot of this starts with that inherent alignment that we have, and then the trust in the different organizations, and that kind of we start to work with one another. And that gives us an opportunity to be able to surface innovation quickly and make those introductions and connections that ultimately lead to great kind of collaboration and partnership. And so, I think for me, that friendliness and that long-term relationship is absolutely vital.
We obviously want to learn about your ecosystem, but there's a clear need from Nashville's as well to learn about ours. And there's that interest from both sides of the pond. So I think that helps the relationship going over the right.
And our company has been the beneficiary of forging these international collaborations. It's not something that you immediately wake up one morning and know, here's the path. And every relationship's a little bit different. If you had Nashville CEOs that were listening to this podcast, what would you want them to know about the opportunity that exists within the UK to establish a landing spot and to think about commercializing healthcare technology?
So I think one of the real strengths that the UK has is in the kind of clinical innovation that exists and the ability to generate evidence and so on. So we've got incredible data sets, we've got incredible assets around the country that companies are able to tap into. And there is a real need for genuine innovation where the UK health system is facing real financial challenges, real challenges in keeping up with demand in all of this. And so there is a genuine need and appreciation, I think, from senior leaders across our National Health Service to really explore innovation and to try and improve efficiency and productivity within our health system. So I think the conditions are right in the UK. There's a willingness and openness from the system to look at technology. There's incredible assets across the country in terms of being able to prove out and validate some of those solutions within our health system. So I think clearly my message is going to be out there to those in Nashville and across the US to say, look, do think about the UK, do come and talk to organizations like ours and to others to help signpost and provide the sort of support that those companies need as they come into the market. But do think seriously about being part of the UK ecosystem. Yeah.
I think that a lot of times healthcare here, depending on who you're talking to, the target from a sales perspective might float a bit. One of the things that really struck me spending a lot of time in London and then in Leeds on a recent delegation was how united different stakeholders were around the NHS plan, this kind of 10-year plan. And I think for a lot of innovators, as they're thinking about building a solution to build towards that plan, at least directionally, it at least gives them a compass direction. So I don't know if you could talk about that a little bit and what you're seeing in terms of just NHS strategy and how it's evolving.
Yeah, so the current government set out a 10-year plan for the NHS that covered a number of different shifts, if you like, within the health system and a number of different areas, all of which have a sort of technology component and opportunity to them. But obviously we have a very differently organized health system, and certainly in terms of its payment models and how that works, it's that's something I think that companies from the US need to really understand and embed themselves in. And so I think much as you would invite a UK company to spend time and get to know the system in the US market, it was very similar. You need to think about spending time and being in the UK to understand where those different areas of strategic alignment are with your solution and the direction of travel within our health system. So yeah, I think the invitation is there to come and be part of that journey and really get under the hood, if you like, of where our health system needs solutions from the US.
A little bit of Southern hospitality there too that I see that's making its way.
Yeah.
Okay, so Nashville is obviously an entry point. That's where you are today. Tell me a little bit about where you're headed next. You're going to Memphis.
So we've spent the first 2 days here in Nashville visiting some of your amazing assets and institutions. So we're going to Vanderbilt tomorrow, and then we're heading to Memphis. But on the way, we're actually stopping off at Jackson, West Tennessee Health, which is great. It uses into some of that rural conversation that we've been having as they have a clear focus on that. And then we'll be in Memphis for Thursday and Friday. Again, meeting with some really great institutions, be with Ortho South, Baptist, St. Jude's as well, Regional One. And it's all really about understanding how each of those differ and operate and really where the opportunity lies for our delegation.
And the complement to that both cities have with the variety of people and players is really fascinating. Yeah.
So what does success look like for ABHI? You're identifying these entry points. How do you measure success? And I can think back to 2018, some of those friendships that I made on that ABHI visit, those are still friends that I have today. So it's probably hard to quantify it over a long period of time, but what does success look like?
I would say our delegation, so it's made up of UK health tech companies, medical device, digital health, diagnostic, all fairly successful in the UK. Most have a footprint in the UK and selling into our NHS. And the US is a brand new market. So what success looks is really about them understanding the US market, how it operates. Some of them are looking for pilot opportunities. Others actually already have a bit of a footprint in the US and are looking to expand that. So success is different depending on the individuals, but it is mostly really them having a deep understanding of, okay, what is it actually like doing business here and how do I make that a success ultimately?
Yeah, I think if they can go away understanding the opportunity that exists in Tennessee as a real healthcare hub for the nation, and in the longer term, clearly we want to have those businesses and those technologies from the UK investing in Tennessee. We want to see them here, building their businesses, employing people here. We want to see all of that kind of piece that comes with growth and so on. But I think for us, and I think certainly from ABHI, selfishly thinking about it from our perspective, it's about how do we continue to build and strengthen that kind of transatlantic corridor, if you like, and how do we try and create that sort of metaphorical healthcare bridge between the UK and the state of Tennessee, which will allow innovation to flow in both directions, but also allow for some of those institutional collaborations to happen between research assets, between healthcare providers, whether that's hospitals like we're represented today through Bart's Health and others and so on, working with providers here around some of those common healthcare challenges. So it's how do we wrap all of that out? How do we get folks in the room, talking to one another, collaborating with one another, building those long-term relationships that fundamentally will benefit patients on both sides of the Atlantic?
And a mantra of the Global Health Innovators is serendipity. It doesn't happen by accident. And so much of what you're describing is the intentionality with which we make these conversations happen. We bring delegations to one another. We establish programs like we just announced here in Nashville, the LIGHT program, right? There's so much exciting work. So feels like an appropriate question to end on. Tell us about a moment of serendipity in your career for ABHI, whatever that looks like, but a conversation, a connection, a wrong turn that ended up being exactly right and led to a moment of serendipity.
That's an easy one. And there's
You've been in the game much longer. You'll have a good.
Okay, I think this journey in Tennessee and specifically with Nashville started nearly 15 years ago with a group that was led by your governor at the time coming over to the UK. And it was effectively a chance meet almost in the UK at a reception with our organization and a number in the room that were representing healthcare as part of that grouping. And it was a handshake, and it was just we were thrust together in that moment and said, well, we've got to know about Nashville, got to know about Tennessee, this incredible place, you've got to come and visit. And then we made the visit over, and that was it. We never looked back. So I think you touched on this at various points during this afternoon. It's often those connections, those choice pieces of sort of serendipity that happen around that kind of start a conversation, and it all just snowballs from there. So yeah.
I might have one more question, and it's something that we were talking about before this podcast, and it's, if you were to guide a Nashville company to steal one thing from UK healthcare, what would that be? And then if you had an opportunity to think about what is best about Nashville healthcare that you could take back home, what would?
I think one of the wonderful things about the National Health Service, and there are plenty of challenges with our health system and how that works, as there are with any health system, but I think the fact that access to care is universal in the UK. You can go in there and do it. I think that would be the piece that I would want to encourage folks from the US to consider, is just how do you continue to expand that access to care to the community and so on. I think there's plenty that we can learn from Nashville and the ecosystem here, not least I think the kind of openness to innovation and adoption, which seems to be here. And I think that's come through loud and clear with all of the kind of conversations that we've had with providers and with different parts of the healthcare community here, is that there's a real sense of openness and want and pull for innovation within your healthcare ecosystem. Yeah, absolutely.
Yeah. And the collaboration with your different institutions as well is great to see, and something that I thought was quite surprising, as technically you're in competition, but it's that collaboration which was really great to see.
I like to think is very unique to who Nashville is. And despite growth and transitions and things that we've experienced as a city, we've done a nice job at maintaining that. So, Paul, Sophie, thank you so much for being with us today. It's a pleasure to have you. We wish you safe travels to Memphis, and thanks for supporting Global Health Innovators.
Thank you
for having us.